Hi, everyone, and welcome to the fourth episode of Vitals and Voices. I'm Lathika, and I'm the founder and host,
And I'm Camden, and I'm the co-host, and we
and
serve
we
on the
serve on the
on the
executive
executive team of
of
Vitals and
Vitals and
Voices.
Voices. Vitals and Voices inspires young people to learn about medicine and to get involved with the community at a young age after listening to people versed in healthcare, just like our guest today.
Now, please welcome our guest, Dr. Garza.
Hi there.
Thank you, thank you to Dr. Garza for being able to be our guest on today's episode. It means a lot for you, a lot for us, for you to be joining us today.
Absolutely. Thank you for having me.
Feel free to introduce yourself and share a few things about who you are.
My name is Brittany Garza. I'm currently a first year attending in emergency medicine. I'm from Michigan. I originally went to Michigan State for undergrad, continued at Michigan State for medical school, completed my emergency medicine residency in the state of Michigan at Central Michigan University. And now I'm a first year out into the real world. Um, in my free time, I definitely love traveling, and I love my cats.
I will say I love my cats, well, cat too. Um, but first things first, can you tell us about what inspired you to go into the medical field?
Yeah, so for me, I loved science. I knew that was like something that I was like just kind of naturally good at in high school. Like I just enjoyed my biology and chemistry classes, things like that. And I wanted to do something in that general science or STEM field. I knew things like history, language is cool to me, but like I knew it wasn't gonna be like a career thing for me. So I knew I wanted to do something in STEM, started doing some volunteer work and shadowing at a nursing home that's near to my home. And it was with a physical therapist, and I knew that wasn't quite my speed. It to me it seemed kind of monotonous, repetitive. So I knew I wanted something that was more like puzzle solving, different every day. And what better than emergency medicine to do that? Um, so it was right around like the end of high school into that first year of college that solidified for sure that I wanted to do medicine and wanted to go to medical school.
I love that. I love science too, currently. Now, during med school, what would you say would be the most challenging part to you?
So I think that the challenging part of all, high school all the way through residency is time management and divvying up your time between so many different activities. We all know that it takes a lot to get into medical school, between volunteer projects, shadowing, work requirements, research, classes, all the other stuff. There's so much to do, and time management can always be a problem when it comes to getting all those things accomplished and doing so in a good way. But I found that the earlier I learned how to manage my schedule, whether that, things have changed over time. I used to use like an actual journal. Now I use my phone to set my calendar. So just like using that as a resource for like when I can do things, when transportation time between, going to work, coming back, stuff like that has been really helpful. And the sooner I realize how to utilize those resources, the better I got at it. And I really feel like my stamina when it comes to managing a lot of things at the same time has really increased over the years.
I struggle sometimes with my time management as well, and definitely will use that for the future.
Mhm.
Next question. How do you feel osteopathic medicine gives a unique perspective in treating patients?
So osteopathic definitely medicine definitely has a focus on mind, body, and spirit. Not that allopathic medicine doesn't have that, but I think there's more of a focus, and that's always brought up in our training is mind, body, spirit. So important, I think even more so today than even when I started medical school, how important it is to balance your physical and emotional and psychological health all together.
Mhm.
They do affect one another, and that's another principle of osteopathic medicine is holism, seeing your body as a whole. So your physical health is affected by your emotional health, vice versa. So important. I've seen it in my own health, like when I'm depressed or anxious, how my body responds to that. It's so important. Even in emergency medicine where things are more rapid pace, you don't follow people up in the clinic, still very important principle in osteopathic medicine.
And then following that, what message from your TED Talk centered around women's empowerment would you like to share with any young women watching today?
Yeah, so my TED Talk that I did almost 4 years ago now was called STEMinism. If you can see her, you can be her. You can check it out on the TEDx YouTube channel. It's also on my Instagram page. It's so important to have mentorship as a female in medicine. I'm a first generation physician. I have no one in my extended family even that was a physician. So I'm like, you know, trailblazing here. And I remember those first year two of college, not knowing exactly what the best things to do for being a pre-med was. And I wished at that time that I had someone I could go to for asking those questions. And my TED Talk really focused on how we need to develop like a network of women in STEM to focus on those things, even extending into like when you like get married and have children, like how to manage breastfeeding while you're working, especially in the emergency department where that's a very difficult thing to do. So we need to develop a network, develop resources, and help one another with being a woman in medicine. It's not the same as being a gentleman in medicine.
I really love that, especially as a young woman who will be going into medicine shortly. And then you've talked a lot about like emotional well-being. So how do you balance that emotional weight of the work that you do with your own health, with your own well-being?
Excellent question. For me, definitely my cats are very instrumental in that. My hanging out with my five cats, very stress reducing. I love it. When it comes to like managing things in the moment, like when you have, patients that expire, patients that have bad outcomes. I had a couple patients last night that had like metastatic cancer. It's just like really hard, tough stuff, especially when they're so young. It's very difficult and you see their family members and they're grieving. It just is awful. And it can put an emotional burden on yourself, which, manifests into a physical burden. What I found is really helpful is just talking those things out, especially with like the nurse or the tech or whoever's on that patient's case with you, just to make sure everyone else is okay as well, because it can be very emotional and draining, especially if you don't even know what other people are going through. Like if the nurse has someone in their family who's dealing with the same thing, and this is kind of drawing those experiences out of them, you just don't know what people are going through, and you don't know how specific cases will impact people. So I think talking those things out as they happen, calling it essentially like a hot debrief of things is very helpful. And then going back later and just saying like, how you feeling, yesterday after that case or last week, kind of like a cold debrief, can help to manage, the very unique area, which is the emergency department.
I love
Definitely.
that. You always need like somebody close by to always talk stuff out with, I feel like.
Yeah.
Absolutely.
So, what's your favorite way to recharge when you're off duty?
I love to sleep. I don't sleep a lot because I do work a lot, but when
Mhm.
I do have like today I had like a morning off. Oh my goodness, I slept until 10. I needed because I've been working. This is day 11 of 20 straight. So I needed a morning to sleep before
Wow.
the afternoon to get recharged. So definitely enjoy sleeping. Again, love hanging out with the cats. They love to cuddle with me. I love cuddling with them.
Oh,
When I'm taking a more of like a longer break, I definitely enjoy traveling. I just got back from Costa Rica and Panama about a week and a half ago. Costa Rica was more of a study abroad. Panama was a very delayed honeymoon. And so it's just very nice to get out there, see the world, try new foods, see new people, hear new language and culture. That's a way I can, you can't do it every week, but recharge on a more, couple times a year basis.
yeah, I love that. That seems like a great way to recharge. I personally love napping too, so.
Mhm.
Mhm. Yeah, definitely. How do you continue to stay motivated during the difficult parts of osteopathic medical school?
Yeah, great question. So yeah, getting through medical school is definitely a unique time. I would say that the days feel long, but the years feel short. So it feels like every day is just like, oh my gosh, there's more, there's more, there's more. But then it's like, whoa, I'm done with year one, I'm done with year two. Like, and then all of a sudden I've graduated. It's just kind of crazy. So that's really what it felt like. Same thing with residency, the same exact vibe of it, they're long days but short years. And I feel like, wow, I've already graduated residency. I feel like I just started like 2 months ago. Um, and so to manage those long days, definitely rely on your co-residents and co-medical students to like get like a network of people that, will be there when things get rough. Be there before exam days, to be there as support. Um, Adopt a cat or two. That always helps. And truly, a lot of people adopt animals during medical school. That is a very much of a thing. Especially cats because there's less maintenance involved with cats, and being a medical student is high intensity, so you don't necessarily have the time to, bring your dog out all the time, and lectures are long. So cats are more independent in that way. So that's very much a thing. I would love to see the generation or the cat class. Like, every cat that was adopted during my like graduation year, how they're
That's
doing
actually
today.
so funny. I
Um,
I could imagine there's probably a lot since you just mentioned
yeah.
that almost everybody adopts like a pet during their time.
Mhm. Yeah, it's very much a thing. Some people adopt dogs, and I actually knew one person that uh a litter box trained her dog because it was like a small Chihuahua, and like that was the thing. So like it's a very much a thing to like adopt an animal during medical school and like kind of see them grow. So
That's
yeah,
so
definitely recommend
cute.
that. Which is yeah, so cool. Get your girl gang, get your people, help each other out. Really ask like if someone's asking, is it something's up and something does not feel right, asking people, is everything okay? Is there anything I can do for you? I remember being on the other end of that conversation multiple times, and I really appreciated those people that I had. And then just again with like the time management thing, the more you can manage your time, the less stressed out you'll be, and the better you can perform in all ways. So those would be the things that have gotten me through medical school.
I really love that. And following what got you through medical school, was there anybody in your life that maybe inspired you to like on this incredible path?
Yeah, I definitely enjoyed seeing like my female physicians as someone, going through the medical system growing up. Um, just being in awe of like they can do it. Like women have, jobs and families and they can do all of it. Like it's not like you can have one or the other. So I was really inspired by that. um because I want to be an inspiration to other people in that same way, and that you can be a physician, you can have a family, you can do all the things you want to do in life. It doesn't have to be one or the other, or just two and not the other. So um I've seen those mentors in my life, and I want to be a mentor for other people as well.
I really love that. And I
Yeah.
think you'll help a lot of people.
Awesome.
So, what drew you to your specialty, and was there like a specific moment when it just like clicked, or have you always known that you wanted to go into that specialty?
So at first I thought I wanted to go into OBGYN. I definitely thought I wanted to deliver babies, which is still true. Like I still love OB and I think it's great and fun. I just did not like gynecology. So I was like, well, how do you go through, residency and it's 4 years, and how do you hate half of it? That doesn't seem like right to yourself to put yourself through. So I was thinking like, what is it about being an OB that I liked, and it was like you can never plan out your day. You never know who's going to go into labor, how that labor is going to go. That high acuity, low acuity, everything in between. And I was like, well, that sounds like emergency medicine actually. And so OB-GYN was my very first rotation of medical school, and the emergency rotation was the third one, which is great because not a lot of people have their emergency medicine rotation that early in their third year. So I was very lucky to have that opportunity. And then, yeah, immediately when I was in the emergency department, within the first 2 shifts or so, I realized just how collaborative the environment was. No day is the same. No day in emergency medicine careers are the same. Um, and that's what I really like. So from that moment on, I knew I wanted to do emergency medicine for sure. And here I am.
Well, I love
That's
that,
wonderful.
and
Yeah.
that is wonderful. Now before wrapping things up, what is some advice that you would give to yourself if you were back to your first day of, I'm probably gonna say this wrong, um, OSP, med school.
Idiopathic
I'm just
medical
gonna
school.
say med school, yes.
Um, So something I would tell myself and tell anyone else is don't let any opportunity be unpursued. There are so many things that you can get out of something that you just don't know until you do it. Um, Meaning, like, if someone says, "Hey, do you want to join this organization? Do you want to volunteer for this project? Do you want to do research with me?" Anything, just say, like, within reason, try to pursue those opportunities because you just never know what's going to come from them. I I have innumerable examples of that in my own life, and I know certain things would not be the way it is today without having those, take saying yes to those things before. A great example is I am faculty for Michigan State's study abroad program to go to Costa Rica every year with the medical students. And I know I would not have that position today, and I had it last year as well. So I wouldn't have that in the last 2 years if I didn't go on like 7 study abroads with them earlier in my medical training. So they got to know me very well. I was, obviously very much engaged. I loved studying abroad. So I know that saying yes to those opportunities has led to these current opportunities. So, and that's like one of the cooler examples. So, definitely that'd be my advice to everyone.
I love that so much. And I just want to say thank you so much for sharing your story with us and your voice with us today.
You're very welcome. Thank you for having me.
Platform has been such a powerful source of empowerment and inspiration for so many people around the world.
To everyone in the audience, thank you for joining us on this episode of Vitals and Voices. We're so glad that you spent time with us today and keep listening for more incredible stories. And if you enjoyed today's conversation, be sure to follow, share, and stay tuned for more voices with vision, values, and purpose.
And we'll see you next time on Vitals and Voices.